With the opioid epidemic, we're seeing that more and more people in our city, our state, and across the country are suffering. In 2015, we had 393 overdose deaths in Baltimore City, and that number climbed to 694 last year.
The interprofessional education, Narcan training, that's about stopping the cycle of addiction, came to being because of the devastating issue that we're facing in the country, but right here in Baltimore.
It's not just a public health problem, it's not just a public policy problem, it's not just a public safety problem. It really is a problem that requires an interdisciplinary and all hands on deck approach.
We really wanted our students and our faculty to be part of the solution. We didn't want to just discuss the problem. We wanted to give them skills and knowledge that they could leave a 2-hour training and save a life.
Like, you injure yourself, you have a school athletic trainer.
Speeding stop quickly, it's just drugs are just like,
We, about 2 years ago, decided that one of our goals as a nonprofit was to create more interdisciplinary training programs for students on campus.
We're talking about people's mothers and fathers, we're talking about people's children, our sisters and brothers, friends, neighbors, colleagues. This epidemic really knows no boundaries.
The IPE, Stopping the Cycle of Addiction, event is the first one that we've planned, and it's been very successful, pulling all of the professional schools, faculty from all the professional schools, and students from all the professional schools together.
The goal is really to get students to come together, sit in groups of teams, how they'll work in the real world, and talk about something real world and how they would, as a team, help to better the care of a patient. So Mark O'Brien, who is the director of Baltimore City Health Department, their overdose prevention program, spoke and kind of framed the issue for the students.
The opioids are getting more dangerous and more potent, and a big driver of this is fentanyl. These drugs are dramatically more potent than heroin. In 2012, there were 4 fentanyl-related overdose deaths in Baltimore. Then it was 12, then it was 72, then it was 120. And last year, we had 419 people who died in fentanyl-related overdose situations.
Then we do the standard opioid overdose certification, where we discuss what an opioid is, how to recognize the signs of an opioid overdose, and then how to administer naloxone to someone that you suspect is having an overdose.
You're going to insert this all the way up the nasal and spray. 1 quick dose.
And then we end with a case study, and it's a case study about Jeff, who was a teenager and had a sports industry and got addicted to pain medicine, and then through the series of several years had many relapses.
His doctor prescribed him a 7-day supply of OxyContin. After a few days of taking his prescription, Jeff's physical pain subsided, and he felt a euphoria that he had never experienced before. We look at that case through the lens of each profession, which really makes this an interprofessional education opportunity, learning opportunity. We see where we could be part of the problem potentially.
His dentist extracted the tooth and prescribed Percocet 2.5 milligrams.
But also we see opportunities for where we can be part of the solution, where we can make sure that a patient doesn't fall through if we're communicating effectively.
Okay.
So the response to this training has been amazing. Both times we've held it, we've had to turn students away. Students have an overwhelming response to getting the Narcan in their hands, and a lot of our evaluations have said that every student on campus should get this training.
University of Maryland, Baltimore is built on core values, and the interprofessional education event around stopping opioid addiction really lives that core values and helps us as faculty lead our students toward the mission and vision of UMB to work interprofessionally to solve real-world problems.